Health promotion is a critical component of women's health. We need to reduce the risk of heart disease, cancer, chronic conditions, stroke, and Alzheimer's. Heart attacks are the silent killers of women. The reason being because they don't present themselves usually like in men. They might just have uncomfortable pressure, a squeezing or a fullness or a pain in the center of the chest. They can have discomfort in both arms, back, neck, and jaw, and the stomach. Sometimes it presents itself like an bad epigastric pain, shortness of breath without this chest discomfort. It could be not being able to exercise, nausea, indigestion, palpitations, abdominal pain, lightheadedness, and sweating. Stroke presents itself like in every other person that has a stroke. The sudden onset of numbness or weakness of the face, arm, legs, especially on one side. The sudden onset of trouble seeing of one or both eyes. The sudden onset of trouble walking, dizziness, loss of balance or coordination. The severe headache of no known cause. We try to promote health, staying physically active to prevent the risk factors of having heart disease, type 2 diabetes, colon cancer, breast cancer, falls, or depression. HPV is a common sexually transmitted virus for women. It is the main cause of cervical cancer and genital warts. There are different types. There's type 6, 11, 40, 42, 53, 54, 61, 72, 73, and 80 that cause genital warts. But then there's types 16, 18, 31, 33, 35, 39, 45, 51, 56, 58, 59, and 60 that cause abnormal cells to form in the cervix that can develop into cervical cancer. Definitely 16 and 18 has been linked with cervical cancer. So for prevention for women starting at the age of 11, they can take the HPV vaccine, the Gardasil or Gardasil 9, and that helps the women's between the ages of 11 and 26 prevent the transmission, not the transmission, the risk, the developing HPV. Sorry. Then we have obesity in women, which is classified as a body mass index of 30 or higher. We want to avoid that because it places them at higher risk for hypertension, coronary heart disease, type 2 diabetes, cerebral accidents, cholelithiasis, um, sleep apnea, cancer, osteoarthritis, abnormal menstrual cycles, and high risk pregnancy related to diabetes and hypertension. Some of the recommended screenings that are across the woman's lifespan is they should have their blood pressure at least tested at 2 years. Their cholesterol should start at the age of 20 and check it regularly to prevent heart disease, to at least pick it up before preventing, to be able to prevent heart disease every year. And the dual energy X-ray absorptiometry, the DXA scan, should be done between ages of 50 and 64. Depending on the history of if there's history or risk of osteoporosis, and definitely more frequent after the age of 65. Diabetes screening should be recommended for every age in a woman's lifespan. Mammograms after the age of 40 for every year for women who have a risk of breast cancer. It should be every year. After the age of 50, every 2 years, and after the age of 65, every 2 years to the age of 74. So at 40, it should be every year. Especially, they can start earlier if they have breast cancer in their history. Cervical cancer screening, the women should get a pap smear between the ages of 19 and 39 every 3 years. Between the ages of 4 to 49 every 5 years, as long as they have not um, had a history of HPV. Then also between the ages of 50 and 64, every 5 years also. So pelvic exams should be done yearly. Chlamydia tests should be done for any sexually active woman every year, especially if they have multiple partners. Sexually transmitted infections should be determined individually, depends on how many partners they have and if they've had exposure. Colonoscopy should start to occur after the age 50. With some of the screenings, like for breast cancer screening, the mammogram is the diagnostic test of choice, and the Papa Nicolau smear is the diagnostic test for cervical cancer. Menopause. It's the stage in life where the menstruation cycle ceases and you are no longer able to have babies. So premenopause usually occurs in the 40s. Menopause occurs, it's considered after 12 months of a woman not having a menstrual period, usually around the age of 50s, late 50s. Postmenopause refers to the time after menopause. The symptoms are irregular periods, hot flashes, night sweats, sleep disturbances, sexual dysfunction because of dryness in the vagina, so it makes it painful to have sex, some mood swings, some irritability, anxiety, lack of energy, panic attacks, some forgetfulness, difficulty coping. Some women also experience thinning of hair, food cravings, dry skin, the skin not being as elastic as before, and some irregular heartbeats. Some people are placed on hormone therapy, which is effective for some of the hot flashes and vaginal dryness. Um, Women that still have the uterus need some progesterone aside from the estrogen. And just remember, if you are on estrogen or progesterone, you need to take vitamin D. Osteoporosis. Osteoporosis is a loss of bone mass that occurs um, after the age of 35. Women bone mass starts to decrease. It also places you at a higher risk for fractures um, that are bones are easily fractured. So how do we diagnose osteoporosis? It's with the DXA. And if you have an AT score of minus 2.5 or below, it's indicative of osteoporosis. If you have an AT score of minus 1 to minus 2.5, it's indicative of osteopenia, which is lower than normal bone density that puts the person at high risk for osteoporosis. The signs and symptoms are back pain, usually related by the fractures from the collapsed vertebrae, the loss of height, the stooping posture, the bone fractures because the muscles are weak. Usually the higher risk women, the Caucasian women, the thin bone women, the women with a history of hip fractures, the ones that are chronic smokers or current smokers, the ones that do not exercise or do weights or do not take vitamin D or calcium, and or consume more than 3 or more alcoholic drinks a day. Also, those that take medications including corticosteroids for more than 3 months, aromatase inhibitors, proton pump inhibitors. Those are all put you at high risk for osteoporosis. Plus, anyone with a BMI less than 20 or a history of anorexia, or those who've had weight loss surgery. One of the medications that is used to help with osteoporosis is bisphosphonates, which reduce the side effects and enhance absorption of oral medications. And the woman should take it early in the morning with an empty stomach, at least 30 minutes before breakfast, and 8 ounces of water. Do not take juice or coffee with it because it decreases the absorption of the medication. Take this medication in a sitting or standing position to decrease the risk of the pill becoming lodged in the esophagus, and also remain upright for 30 minutes to decrease the risk of reflux and for the pill into the esophagus. The action of them is inhibits reabsorption of bone, the process where the breakdown of bone and release of minerals occur, which result in transferring of calcium from the bone fluid to the blood. The adverse effects are that it can give you musculoskeletal aches, pains, and gastrointestinal irritation and esophageal ulcerations. Alterations in women's health. Hysterectomies is determined by what is the need for the surgical removal of the uterus. Most hysterectomies are done because of fibroids or prolapsed uterus or endometriosis. The thing is whether we leave the ovaries in or not. Usually, if the ovaries are healthy, they're left in. If they are not, they are removed and they're put on hormonal therapy. So there's a couple of ways of doing a hysterectomy. You could do a supracervical hysterectomy or partial hysterectomy, which is the removal of the uterus, but yet the cervix is left in place. You could do a total hysterectomy, or a simple hysterectomy, which is the removal of the uterus and the cervix. Or you could do a hysterectomy with a bilateral Salping oophorectomy, which is the removal of the uterus, the cervix, and the fallopian tubes and ovaries. Or you could do a radical hysterectomy, which is the removal of the uterus, cervix, fallopian tubes, ovary, and the upper portion of the vagina and the lymph nodes. This is done to treat some of the reproductive cancers. There are procedures that they could do laparoscopic assisted vaginal hysterectomies, or they can do vaginal hysterectomies, or they can do abdominal hysterectomies. With the abdominal hysterectomies, they're opening up through an abdominal incision. With the vaginal, they're going through the vagina to remove, and with the laparoscopic assisted vaginal hysterectomy, they're using the laparoscopic instrument to help with the removal of the menstrual disorders. Menstrual disorders are most common with women with reproductive health problems. Some of the causes are the hypothalamus secretes gonadotropin releasing hormone, also called luteinizing hormones, releasing hormones which stimulate the anterior pituitary. The anterior pituitary secretes follicle stimulating hormones and luteinizing hormones that stimulate the ovaries, and the ovaries follicles respond to the increase in the FSH by producing increasing amounts of estrogen, and the LH stimulates the ovaries to release the ova and secrete progesterone. And estrogen and progesterone influence the menstrual cycle. So some of these disorders present themselves with amenorrhea, dysfunctional uterine bleeding, dysmenorrhea, premenstrual syndrome, all because of the function of the hypothalamus, the pituitary, and the ovaries. Chronic pelvic pain. Chronic pelvic pain is a common medical disorder among women. It is defined as pain in the pelvic region that lasts longer than 6 months and is unresponsive to treatment, which results in a dysfunctional psychological disability called um, um, chronic pelvic pain. Some of the causes, some of the symptoms is abdominal pain in the pelvic region that can be sharp and steady, intermittent. It can be like pressure deep inside. It can be pain when you're having intercourse. It could be pain while having a bowel movement. It causes difficulty sleeping. It causes constipation. It causes depression. So some of the causes are pelvic inflammatory disease, some fibromas, some adhesion, endometriosis. Sometimes you have urological problems like bladder neoplasms, chronic urinary tract infections, kidney stones. Musculars could be because of lumbar fractures or poor posture or fibromyalgia. Fibromyalgia. Gastrointestinal could be Crohn's, could be celiac disease, colitis. Neurological could be shingles, degenerative joint disease, herniated disc, or it could be psychological, personality disorders, depression, or sleep disorders, or sexual or physical abuse. Polycystic ovary syndrome. With polycystic POCS, um, you have an endocrine disorder that affects women in childbearing age. The etiology is absolutely unknown. We don't know why it's caused. We just know that they have an elevated level of estrogen, testosterone, and LH, and a decreased secretion of FSH. So it puts them at risk for infertility problems. They also are at higher risk for type 2 diabetes, cardiovascular disease because of the insulin resistance. Then they would have hypertension related to the insulin resistance. They'll have endometrial, ovarian, and breast cancers related to the high levels of estrogen. They can have dyslipidemia related to the endocrine changes. They can have infertility because of the fact that they're not ovulating, related to the increase in androgen levels and increase in LH and decrease in FSH. And they can also have sleep apnea, obesity, and metabolic syndrome. So what they want to avoid is ending up with metabolic syndrome, which is when they have the abdominal obesity that is greater than 35 inches. They have the high triglycerides, the low HDL, the increase in blood pressure, and the elevated fasting blood sugar. So what are some of the signs and symptoms? Is the infertility, the menstrual disorders with irregular, infrequent menstruations, or absent menstruation, the increase in the hair growth in the face, the chest, and the stomach, and the back, the ovarian cysts, and the obesity, the oily skin with the acne, with the pelvic pain, and the male pattern baldness. So how do we medically manage this? We treat it with diet and exercise to reduce the risk for diabetes and decrease the risk of androgens, and also improve the frequency of ovulation and menstruation. Some of these patients are put on anti-diabetic medication like metformin to decrease that risk for diabetes. They also are treated with hormone therapy, low dose of hormone contraceptives for women, um, and anti-androgen medication to reduce that hair loss that they're having. Fertility medications such as Clomid to assist with ovulation, or they can have assisted reproductive technologies like in vitro fertilization. The diabetic medication is prescribed to lower that glucose, and it also lowers the testosterone and reduces the risk of acne and the hairs and the abdominal obesity. So it's useful for many factors. So with endometriosis, you have the chronic inflammatory disease that is the overgrowth of the endometrial tissue found outside of the uterine cavity, which causes lesions that are usually found in the peritoneal area or the reproductive organs that cause pain, and they're estrogen dependent, and during the reproductive age of the woman. Its cause is also unknown. It's very painful, the growth of the tissue and attaching to the rest of the organs. So these women end up with a lot of pelvic pain, dysmenorrhea. They have low back pain, pelvic pain, dyspareunia, infertility, premenstrual spotting, diarrhea or pain when defecating, blood in the urine or dysuria, enlarged and tender ovaries. So these tissues respond to the changes in the estrogen and progesterone levels. The tissues grows and thickens during the secretory or proliferative stage of the menstrual cycle, and these tissues break down and bleed into the surrounding tissues during the menstrual phase. The bleeding into the surrounding tissue is what causes the pain and the inflammation, and there's also scarring and fibrosis and adhesions that continue with that inflammation. So medical management is analgesic medications like NSAIDs, used for pain management, hormonal therapy, some oral contraceptives, maybe some GnRH antagonists, some progestin. Danazol is used, it's not used because it has adverse effect on developing fetus, so it's not recommended for women who are attempting to get pregnant. Um, there also is surgical treatment that they can treat with a hysterectomy or try to surgically remove the lesions with laparoscopically. And there's also assisted reproduction help for those women. For infections, we're going to talk about sexually transmitted infections. Vaginitis is just a disbalance in the vaginal flora by lactobacillus, which inhibit the growth of yeast and bacteria. So vaginitis is an inflammation of the vagina, which occurs when the vaginal ecosystem is disrupted. Symptoms of vaginitis include vaginal discharge, malodorous, depending on the causative agent, burning, irritation, itching. And the most common causes of vaginitis are Candida vaginitis or bacterial vaginosis and trichomonas. With the Candida vaginitis, this is the one that's like the yeast infection, that's like curd, white curd, and it's affected by some of the hormonal changes, use of antibiotics, which decrease the lactobacillus that grow inside the vagina and causes the flora to go out of control. With bacterial vaginosis, women experiences the vaginal discharge that is grayish and its fishy odor, and it's not contagious to the partners because it does not affect the partners at all. But there is a disruption in the normal flora, which is caused by the decrease of lactobacillus and the increase of organisms in the genital mycoplasm. So yeah, you want to treat those. You treat Candida vaginitis with some Monistat or Gynazole, and you can treat bacterial vaginitis with clindamycin and Flagyl or tinidazole. So, and like I said, partners do not need to be treated for any of these two conditions. We already talked about HPV, but I want to talk about chlamydia. Chlamydia is one of the most common bacterial STIs, and it is diagnosed by cultures. And doxycycline is what we use, or azithromycin. Either or will help take care of that infection. With genital herpes, there is no cure. It is You can be put on antiviral medication like acyclovir to decrease the symptoms and just go into remission with it, but it is not going away. It's that gift that keeps on giving. So women usually have minimal or no symptoms. They usually present with some flu-like symptoms, a malaise, muscle aches, and headaches. Other symptoms include itching or burning in the genital or anal area, or vaginal discharge, or feeling pressure in the pelvic area. The lesions are usually presented by small red bumps with blisters or open sores, in the area where the virus entered the body, whether it's the cervix, the vagina, or the outer peritoneum area. So you can treat also with oral analgesics or cool compresses containing peppermint, or the use of condom can reduce the chances, but it still can transmit if it's in the outer areas. Trichomonas is one of the most common asymptomatic infections that women get. It's a grayish, yellowish, green vaginal discharge with foul odor, erythema, edema, pruritus on the external genitalia, and pain during intercourse. There's sometimes small red ulcerations in the vagina or the cervix. Can be seen once they do a pelvic exam. You treat it with Flagyl, but the partners need to be treated too, and they should use condom to prevent further things. You don't take alcohol while you're taking Flagyl. Gonorrhea is also commonly asymptomatic in women. Sometimes they have vaginal discharge or menorrhea or postcoital bleeding, lower back pain. It is recommended a single dosage of ceftriaxone given with acetomycin or doxycycline, and infected partners should be treated also. With syphilis, syphilis has different stages. In the primary stage, syphilis is painless. Ulcers in the genital area or mouth or whatever the point of entry was, that usually appears between 10 and 90 days. In the secondary syphilis, symptoms occur: skin rash, fever, sore throat, lymphedema, apathy, muscle aches, weight loss, fatigue that appears 6 weeks to 6 months. In the tertiary syphilis is approximately 1/3 of the infected individual will develop this, and without treatment, the bacteria will spread throughout the body, and the symptoms may damage the internal organs and the central nervous system. The treatment for syphilis is penicillin G, and both partners should be treated. With pelvic prolapse, you have usually the weakening of the muscles or ligaments or fascia are weakened, and the pelvic organs descend into the vagina. The patient will complain of having a lot of pressure and low back pain, heaviness in the pelvis or vagina area. They'll have the sensation that the uterus has fallen out. It'll be difficult or painful to have intercourse. This usually happens to women that have had vaginal deliveries, large babies, or forceps or vacuum delivery, poor suturing techniques for an episiotomy or a laceration. The management of this is to put a silicone-based ring in the vagina to support the uterus. Surgery may include a hysterectomy if needed. A UTI in the elderly presents itself with symptoms that are unusual for a UTI, being that they will present themselves with confusion, hallucinations, delirium, agitation, poor skills, and dizziness and falling. This is because as you get older, your immune system is suppressed and weakens the muscles of the bladder, which increase the risk of incompletely emptying out the bladder, which increases the risk of infection, and the decrease of estrogen, which also changes the normal flora and allows for E. coli to grow. So in breast disorders, includes both benign and malignant changes of the breast. The three most common breast disorder symptoms are pain, discharge from a nipple, or palpable masses. With fibrocystic breasts, you're going to have palpable masses that you can feel. You can feel like the tissue is like little cysts beneath the skin. They would be more frequently examined with a mammogram to make sure that the fibrocystic changes are not breast cancer developing. With breast cancer, it is highest in North America, which is incredible. And the early stages of breast cancer usually produce no symptoms and cannot palpate a mass. It's when it worsens that it starts to cause pain. So research has shown that there are no clear benefits to physical breast examinations done by either the healthcare provider or the woman, even though we do recommend that for early detection. The best early detection is a mammogram. And the only determining factor of breast cancer or cervical cancer is a biopsy. It's a biopsy, not the screenings, not the Papa Nicolau smear, not the mammogram. It is the biopsy that is done. That is the definite diagnostic tool. So with breast cancer, remember that surgical intervention can include a lumpectomy, partial or segmental mastectomy, or a simple mastectomy, or a modified radical mastectomy. Radiation therapy usually begins 3 to 4 weeks after the surgery. External radiation therapy aims towards the tumor, and the treatments between 5 days to 5 to 6 weeks. Internal radiation with radioactive substances sealed in a needle and seeds and wires, and a catheter is placed directly in or near or on the tumor. The treatment is given twice a day for 5 days for a total of 10 sessions. With chemotherapy, you have usually they combine 2 or more drugs, 2 or more chemo agents to treat the tumor. Remember that you want to make sure that after she has her surgery, she is healing well, that you assess the wound. Remember, her immune system is a little compromised at the time, so you want to enhance her immune system. You want to make sure that if she's having any kind of symptoms that affect her, like if she's having diarrhea with radiation therapy, you want to tell her to drink more fluids so she doesn't lose all the electrolytes. She needs to replace them, drink Gatorade, eat small frequent meals, maybe to cook everything well, take antidiarrheal medication. You want her to use baby wipes or sitz baths. She might have fatigue. You want her to rest, get plenty of rest. She might have some skin changes that you want to watch and make sure you observe the area, wherever she's getting the therapy. You might want to put some nice warm compresses or soak in warm water so that it promotes healing and increases circulation. With cervical cancer, like I said, the biopsy is the only true diagnostic tool that there is. It's not the Papa Nicolau, even though it does pick up. Remember that most women that end up with cervical cancer has been infected with HPV, or had an early onset of sexual activities, or is a smoker, or has had lots of STIs. The symptoms with the cervical cancer is the vaginal discharge that may be watery, pink, brown, or bloody, and foul-smelling, the leaking urine or feces from the vagina, the abnormal vaginal bleeding between periods or intercourse or in menopause, the painful sex, the loss of appetite, fatigue, pelvic, back, and leg pain. So Treatment is based on what stage of cancer the woman has. Chemotherapy is used for cervical cancer that has either metastasized or reoccurred. Some of the side effects of external radiation for cervical cancer is the fatigue, the nausea and vomiting, the diarrhea, the cystitis, the bruising, the anemia, the skin rash. Long-term effects can be vaginal stenosis, vaginal dryness, premature menopause, swelling of the legs and the pelvic lymph nodes. With intimate partner violence, remember the signs and symptoms of intimate partner violence is repeated nonspecific complaints, the overuse of the healthcare system, bruising in different phases, hesitant or embarrassed about her injuries, the frequency of the injuries. With intimate partner violence, remember that they have low self-esteem, they have probably low academic achievement, they can be using alcohol or drugs, they have few friends, they have a lot of problems with their partner. So your abuser usually is extremely jealous, possessive, doesn't leave her side, is extremely controlling, blames the partner for everything. They embarrass their partners publicly. They control whatever the partner says. So we screen all women for intimate partner violence. We try to provide the screening without the presence of the partner. We also try to see if they want help. If they don't want help, we can't do nothing about it. And I hope you guys have a great day.